Welcome, welcome, welcome. Happy Monday. And it's a pleasure to have you all here today. And we want to get going right away. And, just as again, I'm Dr. Debra Dupree. I'll be your facilitator today with Felicia Amenta from the Joint Powers Authority. And as many of you probably know, we've been doing this about once a month for a little over a year. Because we both get asked lots of questions, and we thought, well, what better way is there than to bring everybody together once a month, encouraging you to submit questions, or we sort of follow, well, what's the latest and greatest, and boy, do we have it for you today. Just as a reminder, we are recording this session so that we do have information that we can send out to you later. We also plan to send a couple of documents to support some of what we're going to talk about. And so with that, without further ado, welcome, Felicia.
Yes, welcome, Debra. Happy to be back.
Thank you. Thank you. And again, thank you for everyone being here today. We're continuing to get people rolling in. So bear with me as I admit some people back into the room. And let's see. Sometimes when I have so much going on, it's like, where is everything? There we go. Okay. So there are three topics that we are going to be, or actually four topics that we're going to primarily be focusing on today. The rapidly changing face of Cal-OSHA, and Felicia is going to be sort of the point person on really bringing us up to date on that, because it continued to change as of last Thursday. And then to ask or not what the EEOC has to say about vaccinations. And there again, things keep changing. And what has really come about, a lot of questions we get a lot, and Felicia and I've had a chance to talk about this, is what are some of the factors triggering the interactive process, or what I like to call TIP? And I'm great for acronyms, as we have lots of them in our field, but this is another way of shortening that name.
You can party on your birthday.
If we could ask everyone to mute for right now, I'm getting some background.
I have no idea.
Okay, so again, we'll open up for questions here and there, and hopefully have enough time to get through all that we have to do. And then right now we are seeing, that employers are really getting flooded with lots of requests for accommodations, and for all kinds of reasons. I just saw something come through my inbox today about revisiting that whole notion of what constitutes a disability under the ADA. And I know we've gotten more lax around, defining the disability because of the 2008 amendments, and focusing more on doing the right thing, being proactive and so forth. But because of the wide continuum of medical conditions that have been coming up, we're seeing more focus on that again. And then what we've also recently realized with the emergence of COVID-19 and underlying medical conditions and so forth is that, should we be handling work-related and non-work-related medical conditions when an employee has both a little differently or not? Because then we are starting to, maybe we have some HIPAA violations. And so I don't know, we don't necessarily have answers to all of this, but it is good food for thought and discussion, right, Felicia?
Yes, absolutely.
Yeah. Well, let's go ahead and get right into the first one, the rapidly changing face of Cal-OSHA. We've been sending lots of things back and forth to keep each other up to date just for today. And so, Felicia, I'm going to let you take the lead on this one.
Well, as many of you know, the Occupational Safety and Health Standards Board voted on June 3rd to adopt revised COVID-19 prevention emergency temporary standards. And then those were supposed to take effect in 10 days. And then in a complete turnabout on June 9th, they voted to withdraw those revisions. And there was a lot of discussion that came up at the June 3rd board meeting. And because of that, they decided to review it further and have a committee, like a subcommittee, to discuss the standards. Primarily because what happened when Cal-OSHA voted to approve these revisions that included all kinds of mandates, things about face coverings and social distancing and vaccination, and some respirator standards as well. They didn't align up so well with what the CDC guidelines and the California Department of Public Health and the governor's June 15th reopening guidelines. So because of that, those were withdrawn. And then on June 17th, the Occupational Safety and Health Standards Board voted to adopt the revised, newly revised COVID-19 prevention emergency temporary standards. So I don't want everyone to get confused between the June 3rd standards and the June 17th standards. What was very different about what happened on June 17th, because you can kind of see when you look at them what's changed, and I'll talk about some places we can go to get some good guidance there. Governor Newsom did something a little unique, and he signed an executive order to allow the revisions to immediately take effect. And so they're in effect now, and they were in effect on as of June 17th, as of the adoption. And the revised regulations reflect the state's latest COVID-19 public health guidance. The updates include changes to face coverings, vaccinations, information, and gathering data, and physical distancing requirements. And on June 18th, and I don't know, Deborah, if we can attach it to the chat or if we can send it as a follow-up, Cal-OSHA did what I think is a really good job of a frequently asked questions. And because obviously I am not the expert of all things Cal-OSHA, right? Our loss control staff are the Cal-OSHA experts and deal with the inspections and the fines, but they do talk a lot about what they're going to be looking for. And what I really like about the frequently asked questions is they talk about what's changed from what was there before. And then they talk kind of about the differences. And also they talk about if as of June 15th, those indoor settings where the California Department of Public Health has required face coverings, including K through 12 educational facilities and healthcare, and there's quite a few other shelters. There's some exceptions to that rule. And they also talk in the frequently asked questions about that the employer must record the vaccination status for any employee that's not wearing a face mask covering indoors. And they talk about those records being kept confidential. And I know, Deborah, you're going to talk about how that we're going to flow into the EEOC, because this is kind of interesting. And they give some options in the frequently asked questions about how you can gather that vaccination record information if you're not going to have everyone wear face coverings inside. And they do talk about the fact that you can collect the vaccination card information. You can ask employees for that information. Of course, that has to be kept confidential. And you can do self-attestation, which a lot of employers are doing. And that's merely just sending out a notification or an email that you're self-attesting that you've been vaccinated. But all of these records have to be kept confidential, right? And I know you're going to flow into the EEOC requirements with this. And that is so unusual for us, because you're right, we try not to collect a lot of this kind of very sensitive information. And in talking with a lot of other employers outside of schools, this self-attestation is becoming an option that a lot of employers are choosing to utilize, which is sort of, we assume that you're vaccinated unless you tell us otherwise, right? And then they also talk in the frequently asked questions that were put out on Friday on the 18th. They talk about if someone does not want to give their status, then it is assumed that they're not vaccinated. And that would be the status that they're. And also in the frequently asked questions, they do talk about in the revised OSHA regulations that you do need to add some information, and this is also going to fall under our loss control department. You have to add some information to your COVID protection plan, your IIPP that lives in your IIPP, about vaccination, and they talk about what that should look like. And what I really like about the frequently asked questions is these are probably just like Deborah, you and I get a lot of questions. Obviously, Cal-OSHA is getting a lot of questions after these standards came out, trying to align them with the CDC regulations and the California Department of Public Health. So they try to be as clear and concise as they can with answering these. We don't have time to go into, because obviously it's 3 or 4 pages, just the frequently asked questions place. But I just think it's an excellent document to help when you're crafting your policies, because I have been getting a lot of questions about some schools that are going to mandate vaccines for their employees and are crafting policy language. So, but I've been getting a lot of questions surrounding that too.
Well, excellent. So Felicia, I do want to let you and all of our participants know that I did put a link to the PDF I have stored in my Dropbox. And so they should be able to access it there by clicking on it now during the program. We will also attach the document. I'll clean it up a little bit because right now it's still in your email. I just saved it to a PDF, but we will clean it up and send it out when we are ready to send the recording, which will be in a few days or later this next week. So yeah, you know, Felicia, so you were just talking about Cal-OSHA regarding, they may ask about vaccinations and so forth, right?
Mm-hmm.
Okay, and then that sort of takes us into the EEOC. And as many of our participants know, that the Equal Employment Opportunity Commission is a federal agency that oversees the Americans with Disabilities Act and is sort of the go-to place as far as what are they saying. And with that, I just want to make sure everyone is aware of the Job Accommodation Network, JAN, because the JAN works very closely in conjunction with EEOC guidances and are really sort of the best resource, to the latest and greatest, I like to say, resource that people have available to them in terms of, you know, recent rulings, you know, what guidances exist for how to accommodate different kinds of conditions. And so please keep in mind JAN, askjan.org is the website for them if you're not already familiar with them. And that's a free resource to employers and employees. So I'll go ahead and put that into the chat box too. So it's a must-to kind of thing. If you ever have questions, that's where you should go first. And so when I bring that up because with the EEOC, it's been a sort of a moving target, just like Cal-OSHA has been. And you know, there's some to-dos and not to-dos. And so I'm looking at a document I have here, and it talked about changing COVID-19 guidance. And this was as of June 11th. So as we know, there's already been some changes on the California side. But the EEOC was a little confusing at first because at first it said that, you know, you could ask, and it went to a could not ask, and now they're back to a can't ask.
Can't ask, right?
You can't ask, yeah. And I did get challenged at an IPM back in May when I was, for someone who wanted to remain off of work until masks were no longer required. And it's like, well, that could be, who knows, you know, and keep in mind, I always talk about, you know, accommodation requests need to be for defined specific timeframes if they're temporary accommodations. It's not something indefinitely that you need to accommodate. And so in that regard, that presented a challenge because we didn't know back then as to when masks would no longer be required. And so and she said, well, you can't ask that. And I said, well, yes, I can under the EEOC guidelines as they existed then, because if you're looking for an accommodation around this, then we need to know and understand the specifics around it. And so I said, are you vaccinated, or what are your plans? Because that will impact the longevity, the duration of your request to remain off work until there's no mask requirement. And so what have you been finding, Felicia, with some of the questions coming your way about the mask on, mask off in the school settings particularly?
Well, and you know, we haven't been running into it as much with the sites. Again, I'll quote from Cal-OSHA, nothing in the revised standard prevents an employer from requiring all employees to wear a face covering instead of having a documentation process. And that's where there's some questions with Cal-OSHA made it quite clear on the 17th that because the question was, is documentation required for a fully vaccinated employee to work without a face covering indoors? Yes. Vaccination status must be documented. And so that is so different, right, from the guidance that we've been receiving from the EEOC. Because of not all our members are in K through 12 settings, some are community colleges and some different settings, but because we are one of the statuses, we are one of the employer groups where June 15th, the governor said that those indoor settings, we're still required to wear face coverings, indoors, includes those K through 12. And I think the way it's quoted is educational facilities. We do have some other facilities that are not K through 12 that have some different issues that they're dealing with. And so they are talking about adopting a mandatory vaccination policies. And the one thing we have talked about and clarified with our work comp panel attorneys, because I've been getting a lot of questions about if we do draft a policy or if we do bargain that we're going to mandate vaccination for our employees, well, two questions I've been getting. One, what if they have a reaction to the COVID vaccine? And what our work comp attorneys have clarified, whether you highly encourage vaccination or whether you require vaccination as part of a written policy or a board policy, any complications or injuries that are downstream from that vaccination can be covered under California work comp law. That's been made very clear by our attorneys. And the second question was, if we mandate vaccination, and it's under the emergency use and FDA hasn't approved the vaccinations yet because the applications have been filed, but they're still working through the process with the FDA. Will our claims not be covered because of that? And that's not the case, meaning that's not something that would affect work comp law or it being covered under workers' comp if they developed an injury or a complication. I just wanted to clarify that because we've been getting some really good questions about all of these changes. And I think this is particularly in light of some of our districts getting ready to reopen this summer that are on year-round schedules. They're getting ready to open in July. And then the rest of a lot of our members, whether they're community colleges or K through 12 or charter schools, plan to open in the fall.
Okay.
So they're getting ready, right?
Yes, yes.
And hiring.
Yeah. So you are finding that some school districts are deciding to mandate vaccinations?
They're looking at it, right? Looking at crafting it, looking at, because some, it's got to be, some people, they're negotiating, it's different ways that they're crafting those policies. So, but yes, some of our members are looking at that now. So we've been even getting language kind of on what kind of language they're including in their board and their district policies.
Okay. Yeah, so this is an area yet to unfold, shall we say.
Sure.
And I just want to clarify that, when it comes to how can an employer know whether employees have been vaccinated, the EEO guidance that I'm referring to came out on May 28th, because there was a period of time when they said you can't ask. And it was like, well, this is really a quandary then. That's almost more of a problem because, how can we make good determinations around accommodations if we don't know if someone's vaccinated or not? That really makes a difference. And so on May 28th, they did update its technical assistance to clarify that employers may ask, but just like you said, Felicia, under OSHA, any documentation employer requires must be kept confidential and separate from regular personnel files. So that's no different than what we're doing in handling medical information anyway.
Right.
Yeah.
And the Cal-OSHA was so specific. They even had the three bulleted points that employees provide proof of vaccination, a vaccine card, an image of a vaccine card, and the employer maintains a copy. That's the one option. The second option is the employees provide proof of the vaccination and the employer maintains a record of the employees who presented proof, but not the vaccine card itself. And the third option is employees, and this is what a lot of employers are kind of choosing, is employees self-attest to vaccination status, and then the employer maintains a record of who self-attests. So
okay.
Then you're just trusting them what they say. They're not providing any proof. So, and that's been quite a popular option, number 3. But they lay out the actual options of how the employers can maintain the records.
That's great, because I think that gives some clarity then too. And I should also say, at the OSHA level, at the federal level, again, they are reiterating, the employer's responsibility for providing a safe work environment. And so again, how can you provide a safe work environment if you don't know? And so what they've said in some different states is that it's not necessarily, this guidance is not necessarily enforceable, but it gives you an idea of how the OSHA would interpret that. Now, keep in mind too that much like ADA, any violations or failure to engage fall under civil penalties, not workers' compensation. And so those can be far greater for employers also. I will share with you that not only have I been a facilitator of the interactive process for many years, I have mediated a lot of workplace cases under Title VII protections, discrimination, retaliation, hostile workplace environment, and so forth. And there's actually a lot of literature out there that it really has raised some concerns about, you're supposed to treat people fairly and equitably. And I see problems emerging, and there's already evidence of it emerging, in that this, to mask or not to mask can create some problems in terms of, the world has been bringing out some very not so favorable human behavior, shall we say. And so our biases and fears, and just started thinking, if you follow any of my work around that, people can feel very strongly about whether people are vaccinated or not, and the risks that somebody unvaccinated may present to themselves. Because the stats are showing, I've talked to some medical doctor friends, that the people who are getting hospitalized still for COVID are those who have remained unvaccinated. And so, but then we also have the variants that are out there. And I think the research is still out as far as, if people vaccinated are still susceptible. And so there's still a lot to unfold here as we continue to move along. So
and I think one of the things I like to point out too is that we are still having fully vaccinated employees getting sick with COVID. And they're always shocked, and they tell us they can't believe it, that they got it. And some of them are quite ill. So far it's keeping them out of the ICU, and they're not passing away from it, but some of them get quite sick. So there is a little bit of misinformation, I guess, that once you're vaccinated, you can't get sick. It just really decreases your chances of getting sick, but you can still get COVID. But that's a little bit of a misnomer. One of the things I wanted to point out that I didn't add earlier, just to finish on the Cal-OSHA piece, that employers should implement the June 17th emergency temporary standards as soon as possible. They understand that since they made them effective immediately, it requires some time to take a look at these things. So I think they're obviously they're saying if the employer is continuing to comply with the November standards while they're implementing their revisions, Cal-OSHA will not cite the employer. So I did want to state that. So that tells me that they're giving us some time. And with respect to face covering, the employers can comply with the June 17th emergency temporary standard by requiring face coverings for all employees while they gather documentation to allow fully vaccinated persons to go without face coverings. So that tells you, both of these things tell you that they're going to give the employers some time, because they understand these things went into effect like that day. So, yeah. And that's always hard when there's no time frame to implement policies.
Yes, yes. And I know in this other thing, I think I shared it with you, Felicia, it was from the front page news, and this is where it talks about OSHA at large and EEOC. And the guidance that came out from that, so there are 4 areas that employers should be aware of: granting paid time off for employees to get vaccinated and to recover from any side effects. And the side effects, have ranged significantly. I know the first time was a breeze, and the second time I was down for 3 days, And then instruct any workers who are infected, unvaccinated, who have had close contact with someone who has tested positive, and all workers with COVID-19 symptoms to, of course, stay at home. Implement physical distancing for unvaccinated and otherwise at-risk workers in all communal work areas, and provide unvaccinated and otherwise at-risk workers with face coverings or surgical masks unless their work requires a respirator or other personal protective equipment. So, Felicia, that raises a question for me, because I know that we had, COVID leave originally, and then we had, again, COVID leave more recently. Given where we are. Is there, maybe I missed it, is there any indication, is there going to be further supplemental COVID leave given these guidances?
So they do speak to this a little bit. Just find where it was. That they do talk about the fact that employers, they talk about the requirements for testing, and they talk about the providing of paid leave, which is still in effect, and paying for the testing, as well as providing masks. And they talk about what kind of masks specifically to provide, and they talk about the type of testing that will be applicable. And they also speak to providing respirators upon request. And we're talking about N95 masks. So I just want to remind everybody that N95 masks need a medical questionnaire, and they need to be fit tested, which you can do at any of our contracted occupational medical clinics. And we have contracted rates for both of those things. So because they speak about that respirator needs, and they also talk about guidelines for the employers with evaluating air quality and around that respirator piece and HVAC piece too. They talk about that as well. So, but yes, there's still paid leave that's that they speak about in here, meaning that hasn't been, that benefit has not been removed.
Okay, I thought so. And so I know I was just presented with the situation last week for resource that services the schools, and the employee had gotten vaccinated and so forth, but then reported being out for COVID again. And so it raised some questions. And so I had the chance of bringing people up to date on this last week. First, I'd like to put out any questions for people out there. Feel free to raise your hand by going, using the reactions, or go ahead and put your questions into the chat box. And so I want to just create an opportunity for questions. Well, those of you, okay, same. Is San Diego County updating the health order to align with OSHA guidelines for employers? For employers manufacturing to follow, or do we just follow the OSHA CDC guidelines? Do you have any knowledge on that, Felicia?
I haven't seen anything specific other than the California, what the Public Health Department has put out. I haven't seen different requirements for San Diego specifically. I've just heard about the state guidelines. So I think those are the ones that that's what we're going by.
Yeah, and I would think, just looking in the past as far as how things are followed, we started at the top level, moved to the state level, and then we moved to the more local level. So I would say be on the watch for additional guidelines that may come forth, because we just don't know yet as far as what the county is planning. And so be mindful of that. And so this is something that's going to keep us on our toes, folks, for some months to come ahead. Gary, go ahead. Unmute. I'm trying to get you to unmute, Gary. There we go.
Is it Kylie? Is that right?
I'm sorry?
Oh, I believe Kylie said, I was asking if I was pronouncing her name correctly. But anyway, it was my understanding that a state rule, that the federal OSHA was I can't think of the proper, had a higher level, overruled or superseded state rules. And if I understood what you said earlier, is that in California anyway, because I'm in Ohio, that this rule would supersede the federal regulations. Is my understanding correct?
Well, if we go by, like, say, just the Americans with Disabilities Act for one, state laws can exceed, but not be less than federal law. Okay, so this is
the most restrictive, right?
Yeah.
Okay.
That applies to all kinds of employment related laws. You can't go less than federal law, but you can exceed federal law. Okay.
Okay.
California, right? California, for example, has many laws that are much more restrictive, and so we go by, the most restrictive.
Right.
Okay.
Okay, question though, yes. So what I'm going to do now then is go ahead and move over to some of the triggers for the interactive process. And in preparing for today's Q&A, Felicia and I started talking about this because a number of questions have began come up from different school districts. Well, when do we do this and when do we that? And so like many things around accommodations, there are best practices, but then there's also, I don't like to say common sense thinking because not everything is common to all people, depending upon your perspective. But we did come up with a list of various things, and it's like with most things, it's not simple. But I've long talked about, many times the interactive process is delayed far too down the road when employees are nearing the end of all their available leave and maybe thrust into the 39-month rehire list under the education code. And that's when my experience over the many years I've been doing this, whether it's for school districts or not, the longer you wait to engage in the interactive process, the more likely you are going to have exposure to potential litigation because people are caught off guard. They're suddenly faced with the potential loss of their employment. And the earlier you can educate, then the more active they can play a role in their recovery and continued working. I mean, we all know people who we perceive to manipulate the system, and they exist. But quite honestly, it's like the old 80-20 rule. There's a smaller percentage that actually do that. And then a large majority of people really want to keep working and preserve their livelihoods. And so this is a document that I'm going to run it by Felicia one more time, but we will send out, with the video recording as well. And I always like to say there are three ways the interactive process can get started. One is if the employee presents information, then the employer is obligated to engage in that interactive conversation and to explore, how does this medical condition impact your ability to be at work, stay at work, and perform the work? Before, we used to focus a lot on performing the work, but there are many medical conditions that don't allow people to be at work. And keep in mind, doctors do not understand the world of work the way we do. And so they oftentimes will give guidances about, temporarily disabled indefinitely. Well, that's not okay. That's the indefinite part that the EEOC does not say you have to put up with. And so there's a rule of thumb that I've used when I work with my employers, that is that if somebody has been off of work 60 days and it doesn't look like they're going to be returning in 90 days, or another 30 days, that's an excellent time to engage in your first interactive process to say, what's going on, and what can we do to facilitate your return to work? Letting your doctor know we have temporary modified work. We have a need for you to be at work, even if you're not doing your full job. But that's an opportunity, not just about the actual return to work, but to educate people about the interactive process and the education code and all those kinds of good things. Many people, as I like to say, again, for those of you who have been in an IPM with me, I say, unless you have a medical condition, this is a whole world out there that most people know nothing about, except for people like myself and Felicia, claims examiners, and those in risk and HR who manage this process. So that's the first area I like to talk about is, if they've been out of work 60, looking more than 90, then that's a good time to have it. The other thing I would also suggest is that many of you can make decisions about returning to work on a temporary modified basis. And many of the school districts have what I call the 60+60. You provide temporary accommodation for up to 60 days. But too many times I see it get extended way past the bargain time frame of 60+60. And so I'd like to put out there that, if you can accommodate somebody temporarily, great. But at 60 days, you should be evaluating, is this person improving? Because if their work restrictions are not changing, or if they're worsening in any kind of way, or having problems with attendance, that suggests that being back to work may not be in the employee's best interest. It could be prolonging or actually delaying recovery. And so if those work restrictions are changing in those first 60 days, getting better, then I would ask you to question whether or not another 60 days of temporary accommodation is appropriate, or if they'd be better off going on leave to recuperate. And that would apply to those who have the 90 plus 90 bargain temporary accommodation as well. And then, of course, if people have not reached maximum medical improvement after that duration of temporary accommodation, they again should go off of work because you run over into what the EEOC says is that if you provide a prolonged duration of temporary accommodation, then it looks like you can actually accommodate this person on a long-term basis. It's become a way of life, and that now you're doing it, so why not keep doing it? And so if you allow your temporary accommodations to go on for too long, and EEO best practices are not more than 6 months max, then you run into that possibility, greater likelihood for litigation when you try to remove the person from temporary accommodation. And I know, Felicia, you've got some others that you'd want to throw in, or particularly on legal counsel, right?
I do, yeah. Well, I have some other, I get so many great questions in this particular area. So the work comp claims examiners are not experts on the ADA. They're experts on work comp law. What work comp law, where it intersects with the ADA, is when they're permanent and stationary and they have permanent work restrictions, then, you know, they're not going to send you the whole narrative medical report because of confidentiality. They're going to send you the return to work limitations and all things from the report kind of in a redacted or cut and paste so that you can use those. And then under our rules, you have 60 days to hold a meeting. This is not a this is a work comp rule. You have 60 days to hold a meeting. Otherwise, we need to offer the employee a voucher for money for retraining, supplies and computers and possible schooling. And so those are the work comp rules that the claims examiners work on. When we talk about the ADA and IPMs, we have lots of other situations where I think we should talk about triggers, not just the permanent and stationary status, because sometimes that doesn't happen for a very long time. You guys know if they have surgery, that can be a year or two out. So when they're exhausting leave, that's a time we should look at whether do we want to meet before they go out on their 39-month rehire or request an unpaid leave of absence and lose their salary and their benefits. That's a time we need to look at it too. We also need to talk if there's unions or attorneys involved and they're starting to talk about we're kind of litigations brewing, meaning there's some language that you hear or they got litigated over this particular issue. We need to start talking about whether we want to have an IPM. Maybe they're not permanent stationary yet, but maybe we should have an IPM because of we can see some of these litigated issues may be presenting themselves. Also, if you see multiple doctor's notes, one where they're released to return to work, one where they're off work, or one where they're permanent stationary, and one where they're still on temporary total disability, or they're on temporary accommodated work. We need to meet because right then we have a problem because there's too many cooks in the kitchen, as we say, and it spoils the soup or the souffle, whatever it is. And workers' comp is confusing anyway. And for our injured employees, it's very confusing. And sometimes the doctors don't all give the same disability status. And then what is a school to do, right? And that my answer is meet. We need to talk, right? Because we know we have a potential problem brewing and it's better. The other question I get a lot is, we don't need to have a formal IPM every time we're reviewing temporary accommodations, and certainly not, of course not. You get notes every 4 weeks, every 6 weeks. You don't have to do a formal IPM meeting every time you do that. The supervisors and the return to work coordinator, whoever wears that return to work hat, you're dealing with that. And then now we have had a little more complicated layers where we have workers' comp, disability and restrictions going on, and then we have non-workers comp disability and restrictions going on, especially with COVID. We've had a lot of these things arise, and you're right, I think you wanted to kind of lead or address those a little bit later, Debra, too.
Yeah. Well, we are sort of starting to wrap up on our time, so I do want to go there. And because under the ADA, and I always say like ADA because it's a federal, but in California we have FEHA, Fair Employment and Housing Act, and this is a good example of where FEHA's guidelines exceed what the federal does. But I always use the ADA as a benchmark then, because if we're meeting that, we're most likely meeting FEHA as well. And so the thing is that we're supposed to take a look at all medical conditions and all functional limitations that someone's been assigned. And so it's not been uncommon that we are, dealing with all of that in one IPM. And then it was raised recently between Felicia and I that, oh my gosh, should we be doing this? Because what happens then is that, and Felicia, you can speak to this more, but workers' comp claims examiners are not to possess information about non-work related health conditions. Is that right, Felicia?
We can possess that information if it's necessary for the healing and treatment of the workers' comp injury. So in a case that has underlying what I call comorbidities, we will know about the claims examiners will know about that condition. They're not really supposed to reveal that to the schools, right, or to the employer, but they know about some of those conditions because they can be impacting, prolonging, and sometimes we have to treat those conditions and get those conditions stable so that we can, obesity is one of them, right? Sometimes we can't have surgery until they lose some weight. So sometimes we pay for Weight Watchers to help them lose weight because otherwise we're paying for disability while they're off for the surgeries. That would be an instance where the claims examiner can know about underlying conditions, and also because of apportionment. So there are certain times that they get that information from the treaters, but the treaters decide what they need to know. When an IPM situation in the ADA side, where we are talking about doing an IPM, and let's say there's an industrial back injury, but they have a non-industrial condition of, let's just say autoimmune or lupus or something like that, we have to be very careful, because if we're having one IPM to discuss everything, the report to the claims examiner should not contain information about the non-industrial condition, because that's not really part of our claim.
Yeah. And so then that raises the questions then as far as, much like claims examiners will redact information that is not relevant to the employer, which is why they don't release full medical reports. Then, for example, should I, as a facilitator preparing the summary, redact certain information or state it differently than what I have? I usually try to be very careful and not put diagnoses into my documents to summarize this, because that's sort of irrelevant. We're really interested in the symptomology that is impacting the world of work. Now, many times employers will volunteer that diagnosis, but again, I try not to keep that in. So let me know if I overstep there. Yeah, and so then it's like, well, if we've got two different situations we're dealing with, who pays? And so I think, Felicia, that we'll touch on that briefly, but I think we're going to carry that one over for another conversation, because that's a pretty deep one in and of itself. I think we need to think and talk about that more too, as far as, if you've got a non-work related medical condition that we're also accommodating for, is that really a shared cost when there's also work related injury, et cetera. So any comments on that before we wrap for today?
I think that's something we'll take on a case-by-case basis. We already have some cases now where the IPM is half for a non-industrial condition and half for an industrial condition. So whether that would be paid on the work comp claim or paid by the employer, you're right. I think that's something for a future topic and discussion.
Yeah. Well, I want to say thank you all for participating today. Again, we try to keep this at 45 minutes so we don't encroach upon your lunchtime. And do encourage you, you can sign up for all of our Q&As through the time to come. We will be dark in July though, so please note that we'll resume the third Monday of August. But do let us know about your questions ahead of time. Again, we try to bring relevant and informative and up-to-date information to you. And just want to say thank you to all. We will get a recording out to you with a couple of documents, maybe by the end of the week, maybe the first of next week. Meanwhile, have a wonderful summer. Have a happy 4th of July. Stay safe, stay healthy, stay happy, and get vaccinated. So
wonderful to see you all.
Okay, take care, everyone. Bye-bye.
Bye.